Medical professionals of Reddit, what was a time where a patient ignored you and almost died because of it? When I was in medical school, had a gentleman in his late 60s come in for chest pain, found to have a large heart attack. Refused emergent cardiac catheterization, go through the arteries and put a stent to open up the vessel of the heart, so he could bring his car home, and planned on taking an ambulance back to the hospital. He was in the parking ramp, and it cost $20 a day to park. Came back by ambulance in full arrest, no pulse, and died. Doc had to call his son and explain what happened. He was like, "Yeah, that sounds like Dad, he's always been cheap." Obviously what happened wasn't worth saving the $20, but that seems like really expensive parking. Had a throat cancer patient. We offered him surgery to remove the tumor. It was a fairly conservative surgery. He left because he didn't want a mutilating surgery, and his daughter-in-law had been studying magnet therapy and she was quite good with it. His words, he came back a year later, and was out of reach from any treatment. His cancer was so advanced that there was nothing we could do for him. Patient came in with syncope and general malaise. Found out she had a tiny patch of skin cancer on her ear which she hadn't treated in over a year because she wanted to go to a different hospital to have it removed and just hadn't found the time. It metastasized to her brain, and I think other places. They gave her 5 months max. We had a college student come into the ER and had a wonderful case of appendicitis. He needed to get surgery ASAP, as surgery is way easier and safer if done before it ruptures. He called his parents to let them know, and they told him to refuse because he had a test upcoming in the week and they didn't want him to miss it. He left the ER against medical advice while we were all telling him that if your appendicitis gets worse and ruptures, it can definitely lead to death. The kid luckily comes back about 10 hours later after it ruptured. He gets the emergency surgery, and the amount of time he got to spend in the hospital probably doubled. Holy, those parents are beyond stupid. "I don't care that you're going to die today, you better pass that test on Friday or you're grounded." Probably parents. "Please don't get up on your own." Then he gets up on own and pulls out line going into jugular that leads directly to the heart, and proceeds to bleed all over everything until he passes out and almost dies. Again. One time at the VA after adult circumcision. Do not have sex or masturbate for 6 weeks. Decided to masturbate the next day. All stitches tore. Had a repeat patient, not quite frequent flyer status. As a medic, that would always call for a severe allergic reaction to shellfish every other month or so. She had always had the allergy and knew her reactions were getting worse. After a year, 6 or 7 calls of this silliness, my crew and I stayed in the hospital ER with her and talked at length about the situation, since she'd always stay mum about how it kept happening. She told us she comes from a patriarchal culture, and her father made this amazing seafood soup. If she didn't eat it and force her body not to reject his gift to the family, she would lose her car, phone, or whatever punishment her father deemed necessary. We pleaded with her to do whatever it took to show him it was deadly, and carry her EpiPens with her. Fast forward a few years when I altered course into nursing and joined that ER. Saw a familiar bloated face. Turns out she had gone off to college in another state and hadn't been home for a while, but had visited her folks for a holiday. Of course she had the soup, and despite hitting herself with the EpiPen when her throat started tightening, the reaction continued. Her mom, who I had never seen before, told me she tried to eat it fast and rushed to the bathroom, where she was found on the floor. Medics couldn't tube her in the field, so tried medical management until they could drive her to our ER. Doc performed a tracheotomy at the bedside and she went to the ICU. Took a week for her to recover, and I was told by the ICU nurses that her father finally got it, that her allergy was a real medical condition. Didn't die, but did lose an eye as a result. Young kid, 20, with bad diabetic retinopathy from uncontrolled DM type 1, had eye surgery to remove blood and scar tissue from inside the eye. We told him to take it easy for a few weeks. He went to 6 Flags. Roller coasters are bad. Retina completely detached. I got soft and painful, had to be removed. On every single ride they have those "don't ride with a medical condition" signs, and I always thought nobody would actually think about going on a roller coaster with a medical condition, especially when the hospital tells you to not to do things like that. But apparently. Not a med professional, but my aunt is, and I'd like to share her horrifying story. She once had a patient, young guy in his early 20s, who had very poor hygiene. Didn't shower regularly, didn't brush his teeth, wore the same clothes for days on end, etc. IRC he one day came in with a nasty rash on his lower abdomen pubic area that was starting to show signs of infection. She provided antibiotics and instruction and extensively stressed to him to improve hygiene and keep the area clean, otherwise it'll just keep coming back or get worse. Well, as the story goes, he didn't pick up the prescription and apparently chose to just keep putting ointment on the area. She later found out he ended up in the ER after going into shock at work. Turns out he ended up getting gangrene in the area and it had spread to his penis and scrotum, which had to be removed. My dad tells a story of a morbidly obese woman who came into his clinic and after an exam told her simply, "If you don't make drastic changes to your lifestyle and diet and start losing weight, you are going to die." She was dead within the week. Her family tried to sue because my dad was clearly a witch doctor and cursed her to death. It was sad all around. This is an interesting cultural thing that we talked about when I was in nursing school. Some cultures, like traditional Native Americans or Haitian cultures, believe that if you tell them that they could die from their disease, then that's basically like you're wishing death upon that person. That sucks that your dad was accused of that. I am a nurse and I had a very polite and lovely patient trying to remove all manner of chest tubes and IVs after a motorcycle accident. He was obviously delirious from the pain meds and the head injury, but very nice still. I left him in the care of my coworker for my lunch. 10 minutes into my lunch break, I see him stagger past the break room door like something out of The Walking Dead, trailing blood everywhere, only to collapse out cold a couple of seconds later. Said he needed the bathroom. I don't know how the fuck he pulled his own chest tubes out. Removing them always makes me cringe, let alone doing it to himself. He was put back to bed, this time in the ICU, and got some more sedation, and even though him ripping it all out set him back a couple of weeks, he still discharged and came to say hi and thanks on the way out. The happiest delirious patient I ever had. What a bloody trooper. We had a mom in the NICU who would constantly kiss her premature baby on the mouth. Several nurses educated her around why that's not safe for the baby, and thankfully documented their teachings. This was during cold and flu season, and became even more concerning when the mother was coming in with cold-like symptoms, coughing, sneezing, and obvious congestion. She still continued to kiss the baby right on the mouth. The baby was almost ready to go home by this time, but got extremely sick. The baby ended up on a ventilator, and had quite the extended stay with many, many close calls. My wife is a labor and delivery nurse. When a baby is born, they give it some vitamin that the baby can't produce itself for the first 6 months of its life. Or something like that. I think it's vitamin K to help with blood clotting. It's potentially lethal if the baby doesn't get this, obviously, as they can bleed out internally. Welp, one mother didn't want their kid getting vitamin K 'cause anti-vaxxer. Baby ended up dying in the NICU. No way to know if the lack of vitamin K contributed to the death or not, but I think most medical professionals would point to it being part of the reason the baby died. To clarify, the cause of death was related to a bleeding issue. I don't recall the cause of the bleeding or what the specifics of the issue were, but ultimately the baby doesn't get the clotting aid. Baby bleeds to death. Lacking the clotting aid likely played a role in the death. It is vitamin K which is produced by gut bacteria. Babies have sterile guts until they start nursing feeding. I'm not a medical professional, but I used to get allergy injections to build up my immune system because of the crazy amount of allergies I had. I would get these injections every week, and I was instructed by my family doctor and the allergist to wait in the waiting room 30 minutes after the injection in case I received a reaction. Well, one day I decided I didn't want to wait anymore, also because it had been a few months without a reaction, and left immediately after my appointment. I went into anaphylactic shock not even 10 minutes later. It was crazy because I didn't even know what was happening at first and didn't even know how to use an EpiPen. I was assistant manager of a group home. We had a resident who had epilepsy and was also very reclusive. He would get agitated if we came in his room or even knocked on the door. However, policy said he had to be checked on every 30 minutes because of his seizure risk. That wasn't being done, so I brought this up to the manager. She said she was aware, but it was okay to bend the rules because he would get really upset when we checked in on him. I really wasn't comfortable with her answer, but I was young and assumed she knew better than me. When I was on duty, I checked on him every 30 minutes, and he would yell at me, but I didn't let it bother me. About 6 months later, after I had been reassigned to another group home, he had a seizure alone in his room and was found dead. A day later. Now I'm older and a little smarter. When I find a problem like this, I stick with it and don't let people talk me out of it. Not again. Rest in peace, D. Gone but not forgotten. Patient had vague abdominal symptoms, and I recommended a CT scan. He refused cause he was afraid of radiation. He also refused colonoscopy, so all we could do was an ultrasound, which found nothing cause he was fat, and abdominal ultrasound is a shitty examination anyway. A year later he was admitted again, and this time he couldn't refuse a CT where we found a massive colon cancer. He's probably dead now. Patient came to see me having a stroke due to a blocked brain artery. I'd activated the code stroke team. Everyone was ready in the theater to get the clot out of her artery. Nurses, anesthetist, technician, but she, 42, insisted on updating her Facebook status and checking in before allowing me to treat her. Wasted 3 to 5 minutes and 6 to 10 million brain cells, if she had that many to start with. Do you have a similar story? Leave a comment and subscribe to the channel if you want to see more videos like this one.